Hello everyone, this is a pilot video that will take us through the steps of how to create a digital workflow for a complete upper and lower denture prosthesis. Um, like the conventional process, something stays the same, and that is the master cast that we require for the digital workflow, such as our upper cast here that we've previously worked on, and also our lower model as well. And these are the two models in addition to the bite registration. This is a simulated bite registration out of Lab Putty that we're going to utilize to scan and create a workflow and design the case. So a couple of things that we need to keep in mind, that we need to have as far as designing digital dentures. Obviously we need the software, and using a desktop CPU with ample memory and very good graphics is very important, and also a good size screen that you see there. In addition to that, the software is attached to a scanner here, and this is a one of the latest scanners by 3Shape, and this is a texture scanner, and you'll see it a little bit later on how it works. And so all these three items work together to create the workflow. So first thing we need to do is actually open up the software, and on your screens on the left side you'll see the 3Shape dental system. This is the icon with a tooth, so we're going to double click on that, left double click on that, and we are going to agree to the licensing terms and conditions. Here at George Brown, we're licensed to use the software and for X amount of time, and at which time it needs to be renewed. So we have all rights to use the software here. And if you do purchase the software for your own personal use, it comes with an expiry date, of course. And during that time, there's probably going to be updates that you're going to have to download and keep up to date. So once we open up the software, there's actually videos from 3Shape Academy that you can click on here and go and see. That'll take you directly to the YouTube channel, but we're going to skip that for now. And this is the home page for the 3Shape Dental Manager. So we need to open up a order form. And how do we do that? There's a couple of ways of doing it. We're going to start a new case, so there's a couple of ways of starting a new case. You can right click on your mouse and you can just hit new, or you can go up here on the top left. That looks almost like a blank page, and if I were to click that, that will open up a new case as well. We can also work on existing cases. This is the same case that I'm going to walk you through today. I can right click on that and hit redesign, and that will take me to the design manager, and I can redesign the case. You can see the case now popping up on the bottom left of the screen. So I'm going to just kind of skip that for now. We can also import a file by right clicking, and we'll go to advanced settings, and we can import a file either from a file that we've saved in the document section or an external hard drive. Okay, so for today we're going to create a new case, and that'll take us to the order form. So this order form is designed to accommodate a various number of dental prosthesis, not just complete upper and lower dentures, but we're going to concentrate on complete upper and lower dentures. So if you see here on the right hand side, we can design removable frames, we can design a bridge, abutment for implants, and as well as frameworks for bridges and so forth. And there's another, this is not active just yet, but this is for an orthodontic type of appliance, as a night guard, that we can also design that. But we're going to concentrate on the complete upper and lower design workflow. And what we need to keep in mind, a few things that we need to input into the order form in order to create the workflow is not necessarily, but we're going to put a patient's name. So I'm just going to put my name on there. And I'll put my name as the contact person as well. A couple of other things that we need to have input is the object type. So we're going to click on model. There you got a couple of options here. One is digital impression. So you can import a digital scan from the Trios system. Although at this time it's widely understood that digital impressions for edentulous cases are not there yet because of the biomechanics of the mucosa and how it relates to the scan. You can also scan an impression, and we can also scan a model, and that's what we're going to do today. And this is probably the best way to create an accurate virtual model of what you are trying to produce. Needless to say, the virtual model that we're going to produce here, it's only as good as the impression that we've taken or acquired from our patients and the master models we've produced. So whatever we input into the system, we're going to get out of it. So nothing magical happens as we're working through this. It doesn't correct for any clinical errors or any laboratory errors required prior to creating a work order. So we're going to select model, and for the antagonist, which is the opposing, we're also going to select antagonist model. And this last little subsection here, gives you the options of non-section or unsectioned. We're going to put unsectioned. Sectioned is for crown and bridge models that use dies, so we're going to use unsectioned. And the next little bit that we need to create or complete on our order form is we're going to select the teeth. And how do we do that? Well, for complete upper and lower dentures, we do not restore the third molar, so we're only going to go up to the second molar. So we're going to start in quadrant 1 with tooth number 17. We're going to left click that, and that will highlight the tooth. I'm going to hit shift on my keyboard, and I'm going to go over to tooth number 27 and click on that as well, and that will highlight the maxillary arch with all 14 teeth included. And I'll do the same thing for the lower arch. So I'm going to click tooth number 37, shift on the keyboard, and click on 47. And now I've got upper and lower arches highlighted with the specified teeth from 17 all the way to 47. The next step is we need to tell the software what we're trying to create. And we're going to go to the denture icon here. And we're going to select there's various types of selections, but we're going to concentrate just for the initial design stage. We're going to select monoblock. By default, the system already selects that, so I can scroll over to that one and select gingiva, but we're going to go back to monoblock. We're going to select that, and we're going to hover over this plus arrow here, and gives us a drop-down list. And we need to change the input here as far as the drop-down list in order to create a design. So the first thing we're going to do, by default, the first drop-down item it says GBC zirconia. This is more for bridges and crowns. We're going to change that and scroll down to, or up I should say, to GBC polymer. And the color, we're going to change that. We'll just pick A2, is probably the most common shade for denture wearers. And the next item that we need to specify in the order form is the anatomy section, and by default it takes you over to artificial tooth, which is what we want for complete dentures. And then we're going to hover over the plus icon, and again it gives us a drop down list, and we're going to change some of the items very similar to what we did with the gingival input. So we're going to go GBC polymer and the color PMMA A2. And that's all the information you need for now to start designing. So the order form is complete. All I got to do now is scroll down to the OK, hit that, and that will generate an order, a work order. So this is the one that I had before. This is the one that I generated now. So I'm going to right click on that and hit next. And it gives you this lock icon here. So what we're going to do, we're going to right click on it again, go to reset and unlock. And in fact, as I did that, it started the designing stage. So as it did that, it took me to this stage, and it is asking me, get your attention over to, get my mouse, insert preparation arch, and it shows you the lower arch here. And it says here, front side should be facing into the scanner. So if I can get you to look over to the scanner, as I did that, the scanner kind of came to life, and we got this light. This isn't the light that's going to be used for scanning, but again, it tells you that the scanner is active. So if I can just go back to here, I'm going to take one of these mounting plates, as you see here. Now these mounting plates have 3 little concavities on the underside, and I'm just going to move my camera over to get you a better view. And you can see the little concavities on the underside of the plate, and that will correspond with a scanner. So what we need to do, we need to secure our lower model by using this little putty. So I'm going to take my lower model and just firmly press it up against the plate. Notice that the back side of the plate is flat, whereas everything else is kind of round. So the flat side of the plate corresponds with the back side of the model, very simple. And we want, just like the software told us, we want the front side of the model into the scanner. So I will place this into the scanner, and the whole scanning process starts automatically. So here we go. And you can see here that the scanning process has begun. So the scanner will tilt the model in various ways to capture all the landmarks. And you can see it here trying to synthesize an image on the screen as it's going through the scanning process. When the scanning process is complete, you'll get a prompt on the screen. So you can see it here on the bottom left side that it's still got this ongoing rotary wheel telling you that it's still working on something. And right here it's listing post-processing, so it's still doing its thing. So we're gonna have to be a little bit patient about this. There we go. So we have a perfect duplicate, virtual duplicate of our model. And from here, I can look at this virtual model from different ways. So what I'm going to do next, I'm going to use my mouse. I'm going to right click and hold, and I can rotate my model to ensure that I've created a good scan, and it looks very, very good. These scanners from 3Shape, they're just incredible, and they produce amazing images. It even picks up the color. One thing I want to point out, when you are scanning, if we look on the right side here, if I click the setting icon, down here, make sure you click on text, scan texture. By doing so, the scan will pick up any outlines that you might have made on the model. And I've made some outlines here, as you can see, and we'll talk about these a little bit later when we do some model analysis. Okay? So it's very good. So once this is completed, what I'm going to do next, I'm going to hit next. And now it's asking me to insert the maxillary arch or model for it to be scanned. So once again, I'm going to take my mounting plate, press a little bit of putty in here, take my upper model, firmly press it up against the plate with the back side of the model parallel to the flat side of the plate. And once again, I'm going to remove the lower model, and I'm going to insert the upper. And as soon as I do that, the scanning process starts all over again for the upper arch. And as you can see here over on the screen, scanning in progress. If you're not sure what you're supposed to do, just look at the screen. It's very, very simple, very intuitive. Personally, I've done this scanning and designing process myself by the time this video was made, probably about 3 or 4 times. At first, it was a bit of a learning curve, but like with everything else, it becomes easy over time. So once again, scanning in progress. Now it's trying to render everything together, all the different angles of the scan, and it's trying to produce a virtual image. So there it is. What I've also done for this type of scan, I've scribed my posterior palatal seal, and this will come into play later on when we start creating the base by outlining a spline for the base. So once again, I'm going to right click the image, and you can see it in different angles how that was created. The rotary wheel in the middle of the mouse, if I hover over the image, press and hold, I can move the image to a different position on the screen. Right click once again, hold the image and rotate the image around to look at different angles. There we go. So that looks like another good scan. If I just scroll up and down with the mouse wheel, I can just zoom in and zoom out. So all these things become kind of intuitive after a while, after you use the system for a couple of times. Very easy to follow. All right, so what do we do next? Well, we're just going to look at the screen. It says here, scan completed. Just follow my mouse, click next to continue. Very simple. So I'm just going to go back up here. And now it's asking me to insert wax rim, including upper and lower arch in occlusion. So I'm going to place my upper and lower models into occlusion, utilizing my simulated bite. In reality, you're going to be using upper and lower occlusion rims. So here's my simulated bite here. I'll do it over here to get a little more, bit better lighting. So have everything firmly held together very nicely. I've also simulated my midline and my cuspid lines here, and we'll see how that comes into play a little bit later on when we select the teeth. So I'm going to take some elastic bands. This is a little primitive in terms of sealing things together, but we are working on acquiring some apparatus of attaching things together that's a little more secure, although this is pretty sufficient. Try not to put the bands and obscure any of the lines on your bite blocks, so they're kind of a little bit offset. And once again, I'm just going to use one of the plates, it doesn't matter which one. Take a little bit of putty material, make sure that the little concavities that we talked about face down. And once again, I want to center my models over the plate, and as I do so, I'm firmly pressing the models against the plate so we get a little bit of tackiness for the material. And again, the back of the models are parallel to the flat portion of the plate. And also ensure that my midline here is in line with this little notch. This little notch here. Barely seen on video, but it's there as you saw on the other plate. And all I gotta do now, once I have everything together, insert it in my scanner. The scanning process will start automatically. And once again, if we go back to the screen, you can see an image that's being rendered there. And you can see here scanning in progress. It looks like the scanning is completed, but the software still needs to mesh everything together and produce an image. As it does that, I'm just going to realign my camera here. So there it is. So we have two models virtually articulated. And what we're going to do here is just follow the screen. It says here scanning completed. Click next to continue. So I will hit next to continue. And now we need to align lower arch so into the bite, as well as the upper arch. So sometimes it does it very well, but it's always best to use, in my opinion, the 3-point system. So I'm going to click on 3 points right here, either 1 point or 3 points. And you have a trash bin here. If you want to redo it, you can trash all the points and redo it again. So what I'm going to do here, I'm going to pick a point here, and I'm also going to pick that same point as close as possible on this model here. I'm going to pick a point at the front here, rotate again, scroll wheel, hold and pull it up, pick a point here, rotate, and you see this little white little spot here. I'm going to pick a point there, and my third point will correspond there. So once I pick the 3 points, the software will tell me how close I came, and I was fairly close. And all I got to do now is go back to this upper image here and bring those points together as close as possible. Obviously, the more I zoom in, the more accurate I can get, but it doesn't have to be extremely accurate. I'm going to rotate this around and bring that dot overlapping that dot, and then rotate that around and bring that dot overlapping that dot. And once I have it done sufficiently, the system will prompt me to the next stage, and it says here we're going to alignment result. It's all good, and I'm going to hit next. And now it's asking me to do the same thing for the upper. Very simple. So I'm going to rotate it here again. I'm going to zoom in, bring this down a bit, pick a little spot here, see if I can find that same spot here. If you can't find that same spot there, all you got to do is just trash, start all over again. So there and there, rotate. I'll pick one right at the tip here. That's pretty obvious, right there, and then I'll rotate it here, and I'll pick one right at this corner, rotate right there. So let's just see how close we came. We'll zoom into this image, drag it down a little bit, overlap the dots, right click, rotate, left click, overlap, right click, rotate, left click, and overlap the dots. And everything is good. All right, so the next thing we're going to do, there's our articulated models. So if you look up here on no, it doesn't give me a prompt yet, so I'm going to hit next. Now it's telling me, if you read on the left side of the screen, paint to select area of interest, control and paint to select, shift scroll to change the radius. So I'm going to rotate and I'm going to select the area of interest, which is the bite. So I'll just do it in each on each side. You can go a little deeper here, it's fine. I'm going to rotate that too. And we're going to paint the left side. And I'm going to hit next. So up here on the left screen, scans are saved. Great. Now it's giving me a prompt icon on the top left to start designing, which is great. Okay. So I'm going to hit design. Now it's taking me to the Design Studio. Should bring up the two scanned images articulated. There we are. And from here, we're going to start designing. So a couple of things before we start. If you look at some icons up here, you can drag these icons and reduce the lower model or reduce the upper model, or reduce the byte registration itself. So there it is. So we have two articulated, virtually articulated images of our master models. Now sometimes as you rotate this, it gets a little confusing and you want to get back to where you started. And it's very simple. So if you go on the right side of the screen, there's some viewing angles that you can just pre-select. So this will be the front angle. This will be the angle from the rear, and top and bottom. So I'll just go default it to here we go. Okay, so let's read the screen. So we're into model analysis screen, and it's asking us to identify the occlusal plane. And we have to say, we have to pick 3 points. Place 3 points to define the occlusal plane. So I'm going to click on this icon. Now, in order to pick 3 points, I need this back. I need my wax rims back. So I'm going to right-click, rotate. I'm going to pick a point halfway up the retromolar pad in correspondence with our wax rim. There's one. I'm going to pick another one here and another one here. I'm going to go a little lower than the line that I've outlined there, because I think I was a little bit off. So I'm just going to go a little bit lower. There, I clicked it, and as soon as I click it, there's my plane of occlusion. Now I can go back to the bite registration icon, reduce that, and see how well my plane of occlusion fits into some of the theory concepts that we talked about in previous semesters. So if you recall, the posterior level of the plane of occlusion should be halfway up the retromolar pads. It's not exactly. So very often in the clinic, you're going to make some mistakes when establishing plane of occlusion. And as you heard me say before, this is probably one of the most difficult things to achieve, that chair side. But we can change that here. So if I left click this, I can change it one way or another. Okay? Where do I want to change it to? Well, by having those marks on my retromolar pads, they certainly help now. They can serve me as a guide. So I'm going to tilt this a little bit and bring this down. So I can move it up or down, but you can't variate too much here now. You can make some corrections, but if you have to make a big correction, you have to go back and question what you did chair side. So once again, the system is only as good whatever you put into it. Okay, right click, rotate, and we have this grid in the back. If you want to get rid of that grid, I'm going to go up here. Oh no, it won't let me get rid of it yet. I'm just going to tilt it so I get a single line from the sagittal view. And this now I can change it up or down if I need to. So for example, if your bite blocks gave you a plane of occlusion interior posterior that looked like this, well obviously that's incorrect. Or if you had it the other way, where you have excessive on the maxilla and insufficient on the lower, it's incorrect. What would be ideal, as we mentioned before, you want your plane of occlusion to be parallel to maxillary and mandibular residual ridges. So I'm going to leave it as it's shown there. That looks pretty good. Maybe just lower this ever so slightly. Just a bit. That's good. That looks good. So I'm just going to hit frontal view so everything is nice and square. Everything looks nice and square. Halfway up the retromolar pads, left to right, I am parallel to the maxillary and mandibular residual ridges. If we look at it from a side view, that wasn't a side view, obviously. Let me just go back. Everything looks parallel again. Okay, so once I'm satisfied with that, I'm going to hit next. And now we need to identify some landmarks, and all you got to do is follow this list here. And because I made some pencil marks on the models, it becomes a little easier. So it's asking me to identify tuberosity number 1. So I made a little mark here earlier, so I'm going to do that. And now it's telling me to go to incisive papilla. So all you got to do is just follow the drop list here and follow that. So incisive papilla. Now, in my opinion, sometimes the incisive papilla can deviate from left to right. So I would caution you mark the mid-palatal suture as it crosses the crest of the ridge near the incisor papilla. And now we're going to go to tuberosity number 2. How would you classify tuberosity number 1 and 2? All you got to do is think of working from quadrants 1 to 4. All right? So canine point number 1 here, canine point number 2. And now it's telling you to identify mandibular points. So I'm going to hold my scroll wheel, drag it up, and I can change the angle of this if I wanted to. Right? I can change the angle. And I'm going to identify retromolar pad center number 1. So I'm going to go to quadrant 3, retromolar pad buccal. There. Maybe rotate a little bit to identify the lingual center ridge point. That was incorrect. So if you click on the wrong point when it should have been here and I clicked it here, unfortunately, you got to go back and redo, which doesn't take an awful lot of time. So I'll do it rather quickly. So tuberosity number 1, incisor papilla. You can zoom in if you like to get a little more accuracy. And then canine 1 and 2. Hold the scroll wheel, drag, tilt a little bit to get a better angle. Retromolar pad center number 1, buccal of 1, lingual of 2, center ridge point, which is right here at the labial frenum. And then we're going to go to retromolar pad number 2, the center. Just move this over. And then the buccal aspect. Rotate a little bit, right click and hold, left click, and then rotate, and then canine point number 1, as you can see the little pencil mark there, and the other one over here. Fantastic. So we're giving the software points of interest that is important for the software to so we can start designing. This is the next stage is the we're going to create a splint. So we're going to create the base of our dentures. This is a very important stage. So take your time when you do this. I already scribed in, as you can see there, my posterior palatal seal. Make sure you do this before you scan the models. And you can see the outline of the pencil line. Because I picked the texture scan, it comes out in the scan, which is very helpful. So I'm just going to go back to the original view. I'm going to move my pointer over to this little icon. And now you get a little pencil. Right click to create or the angle that is more favorable to start creating the spline. I'll zoom in. I mean, you can get a lot of detail here. And I'll start, it really doesn't matter where you start and finish, but as long as you come all the way around. So I'm going to left click here and here. And the area that I'm aiming for is the inner ledge of our land area. Do you remember this land area in our conventional dentures? Well, this becomes very important again. I'm just going to drag this down. And I'm just going to keep going all the way around. Well, what happens if you misplace the spline like that? Well, all you got to do is hover over the spline, right click, and it'll give you some options. Add point, delete spline, or just undo the last one. That's exactly what I did there. All right, so if you happen to go off, right click over the spline and undo the last input. So I'm just going to tilt it a little bit so I have a nice view of the ledge of the land area, and I'll just keep going all the way around. So left click. I might want to rotate to make sure that I'm exactly on that ledge to get a better view. Hold my scroll wheel, move it up, zoom in if you like. Now, this area here, you can go all the way back to the land area, or I like to go just a little bit past the posterior border of my posterior palatal seal. So this is where I think I'm going to be finishing the denture according to my posterior palatal seal. So I want to go a little bit past it. Remember, this is something that's going to be printed or milled. And you want to make sure that you have something that's a little bit longer. You can always trim it. We're still going to do some final trimming and polishing. Nothing is going to come out of the printer or milling machine absolutely perfect. So as I get close to the other side, I'm going to join to my initial point, and this is where all the magic happens right here. It just created at least the initial layer of the base. That looks great. So from here, I'm just going to hit next. And now I'm going to do the same thing with the lower model. So once again, you can zoom in, you can change the angle, and move your arrow over to this icon, green icon, and you'll pick up the pencil and start placing the points for the spline. So I'm left clicking, zoom in or out with my scroll wheel on my mouse, hold the scroll wheel, move the model over, zoom in, right click, rotate. And then right here in the retromalohyoid area, I'm going to rotate it to get a nice view to ensure that I hit the ledge of the land area. Because if you don't get the right view, you're going to do this, and then you did that. You see that? That's not correct. So we're going to hover over the spline, the last portion of the section, right click, undo, and I'm going to go over here. That's a whole lot better now. I mean, you can get really close with your points, but that's not really necessary. You can see how the software is kind of rendering the lines together in a smooth line, not necessarily in a straight line. So it works very well. I don't think that you want to do this. It tried to, but it didn't work out. So I'm going to right click, undo. So those 2 points were too far apart. And as I get near the end, I'm just going to zoom out this time, and you can see how everything is going to come together just like that. So that looks great too. So I'm just going to hit next. So now what it's asking us to do is to create a path of insertion for upper and lower dentures. It's not really necessary, but you could create a path of insertion. So I'm going to go to a side view there. And if we look over here, I'm going to insert direction from set view, which is the default. Okay? And I'm going to set it Sorry, I'm just going to reset that. There. So I'm going to press this forward arrow towards the interior portion of the model just once, and you can see that path of insertion changing in increments of 5 degrees every time I do it. So I'm just going to go back. You really don't want any red arrows showing. So that's 5 degrees right there is sufficient, and I haven't changed anything on the left or right. So that was the thin line is the initial vertical, straight up and down, and then we have a slight angulated path of insertion from the interior. So I'm happy with that. I'm gonna hit next. And you can see in here that the software gives you an undercut line here. And it's telling you, do you want to relieve this area? I'm going to do it for the demo, and I'm going to hit, you can see here on the left side, in terms of the thickness, keep this at a minimum. I like to keep it down to 10 microns and 1.4 millimeters in radius. So you can either add, take away, or smooth out. So I'm going to add initially. Just change the angle so we got the proper angle here, just to show you, and then we can start blocking out any undercuts. Try not to overdo this stage. Ideally, if you have severe undercuts, you want to do this. In the real world, if you remember with conventional dentures, we don't block them out at all. So you don't have to block this out right now. You can relieve the undercuts as you see fit upon insertion. But just for the demo purposes, I wanted to show you this. So we can relieve any possible minor undercuts. Obviously, if you increase this here, you're going to create a lot of relief. So keep this to a minimum as much as possible. So I'm going to hit next, and again, it'll prompt me to my lower. And I'm just going to hit next. By default, I want this pretty much a straight up and down insertion. Possibly tilted posteriorly. So I'm just going to rotate my model a little bit, and I'm going to scroll the other way. So I'm going to click it, and you can see that line now. It's kind of inserted from posterior to interior with a slight little posterior inclination. So I'm happy with that. And now, again, if we read on the left side of our screen, it's telling you to block out. If you recall from last semester, the most common areas to block out for the lower is the retromylohyoid undercut area, which is this area in here below the retromolar pads. Try to do it as smooth as possible. Maybe in this area here, I can increase the thickness of the sculpting tool, and you see what happens there, right? There's a lot. It adds a lot and a lot and a lot. And now if I went too far and I want to reduce it, I'll just go back here and select the negative icon and start taking it away. I'll go back to the plus, reduce the thickness, and reduce the radius a little bit, or let's increase the radius a little bit more. You can see the radius gets bigger, but the thickness doesn't. So it all depends what you feel comfortable with and how fast you want to work. All right, so we're happy with that. I'm going to hit next. So now we are our tooth library stage. You can see down here we're given certain selections of teeth. The provider here is Candelar NFC, and some of the other options that are available is just Vita, the ones that are in bold. The other ones are not available. So either this one, and if they are available, you'll see them in bold. So I'm going to go back to the Candelar NFCs, and I'm going to pick the interior maxillary 1x6 interior arrangement, and I'm going to pick, let's see this one, and hit apply. And this is quite magical, what happens here. If you recall, this is something that takes us hours and hours to do, and the software did it in seconds. Okay. This looks a little excessive to me in terms of the teeth. You can see how far back the teeth went. So just by selecting the upper 1x6 arrangement, it defaults to everything else. So it selects what fits that arrangement the best. So obviously this here, this is too far back. We're not going to place posterior teeth this too far back. So I'm going to pick another arrangement. So I'm going to go back to, instead of picking the NFC Plus 556, which is a 47.56 interior width, I'm going to pick this one, 44, and apply. You have to hit apply. And the software will make all the necessary changes according to that arrangement. Let me pick another one, just for the sake of the demonstration. So this is the smallest one of the bunch, and I'm going to hit apply. See if we can pick up any visual changes. There it is. So everything changed. It changed the whole 1x16, or 1x32 arrangement, I should say. 1x28, my apologies. So you can see here the second molar is not as aggressively over the richer molar pad as it was with the bigger mold. So everything changed accordingly. The problem is, with this mold, which is the smallest one, this canine line, is it over the middle of the canine? Doesn't look like it. Doesn't look like it is. So possibly, if I were to select the one bigger and apply, there. So now that canine, that middle of the canine, is a little closer to our canine lines as selected. So we'll go with this. Just for the sake of demonstration, we'll go with this. Now, a couple of things that you want to verify before you move on to the next stage, okay? If we look at just one arch at a time, we can view both arches or one arch at a time. So I'm going to go up here and minimize the maxillary model completely. And the next icon down is the tooth icon. Drag it over, or if it's all the way there, you can just left click all the way and it goes away. So now I can right click. It doesn't have to be on the model. It can just be on the screen. Right click, rotate here. I'm also going to fade out this blue occlusal plane that you see here by just going here and drag it over to the left so I can just get a better view. Now here you can move the whole arrangement one way or another. You can move it interiorly or posteriorly, and you can rotate it as you see fit. And as you're doing it on one side, on one arch, it does it on the opposing as well. Now, if you've gone too far and you're like, well, I think I should go back to where I started. Just go back over here and undo, undo, undo. Keep undoing until you can't undo anymore. You're back to where you started. So the software will give you the most ideal position, but before you start moving it around, verify against some landmarks. So what are the landmarks? Well, here's the crest of the retromolar pad. That looks pretty ideal. Possibly we can move these guys in and move these guys in. You can move individual sectants, so either posterior or interior teeth at a time. But make sure when you do that, make sure you do it symmetrically. And I'll show you what I mean in a second. But before we do that, let's move on. Let's look at the upper model, how the teeth relate to the upper model. So once again, I'm going to fade out the lower teeth, fade out the lower model. Now I have nothing. Well, it didn't go away. All I gotta do is go back up here. This is my top model, this is my lower model. Go up here, drag this icon, bring my model back. There we go. And then drag the upper teeth, lower teeth, upper teeth, drag it over, and see how this relates now to some of the landmarks. So it looks like it's equal distance from the mid-palatal suture to either side of the teeth, so I'm happy with that. And it looks like the midline is in line with the contact point between 1-1 and 2-2. So I think I'm pretty happy with that. I don't want to mess around with this too much. This looks pretty good. Okay. So I'm just going to go to a top view. Change that around, and then I'm going to bring back my lower arrangement. And remember, what you do to one happens on the opposing. And I'm going to go over on the left side and go to this icon here. Click on that. And now this will allow you to move sections, posterior sections or interior sections, but make sure you click on symmetry, symmetric design right here. So if I go over here now and want to move these teeth in, see what happens? They happen at the same time. You don't want to do them individually because it's against the game how much you're going to move each one. So just make sure you do them symmetrically. So that looks good. So now I have my central fossa of my posteriors more in line with the crest of the retromolar pads. That's perfect. So I'm happy with that. Let's see how that affected the maxillary arrangement. So obviously this is a section that you got to spend some time on and make sure you're comfortable before moving on to the next stage. We can also move individual teeth by selecting this icon here, and I can rotate a tooth one way or another or not. And I'll just undo that. There. So it's back to where to an ideal position as generated by the software. So I'm going to leave it at that. We can always play around with this during class time. And I'll bring back the whole arrangement here now, going to a nice frontal view. Certainly we can bring this back. This is our bite block, but really it's unnecessary. And if you're happy with the tooth arrangement at this point, we're going to hit next. Now this prompts you, it says minimal denture base thickness of 2 millimeters. It violates. That's fine. We're going to hit yes to this. And now, in order to start sculpting the base, we have some options. We can go into delicate, natural, or intense. I suggest that we leave it just for natural at this point. We can always play with the system a little bit later on. And all the settings here, leave it as a default. So I'm just going to hit next to this. Now it tells you here, 3-axis drilling compensation of the denture base with undercuts may potentially remove material in retention area. Material removal can be minimized by setting optimal insertion direction. So remember at the path of insertion that we selected earlier, and depending on the undercut, this, you can minimize this during the milling, not so much for printing. So I'm just going to hit yes to this. So it takes a little bit of time to render things together. As you'll see, there's a lot of images that are going to come on the screen in a bit. And you can see now you don't have a pointer. So there it is. So we're going to do the same thing on the lower. We're just going to hit next. We're going to hit yes. And we should get at least the basic rendering of the denture base that we can start sculpting. So there it is. There's my upper. And there's my lower. There's two of them. So by hitting on the upper, I can minimize the model. You can see here there's quite a bit of a flange in terms of how this product is going to be fabricated, how it's going to look in the final result. I don't want that. So if you recall from our conventional fabrication, this doesn't look normal. Okay, so we need to fix this up. So I'm going to also minimize the lower. I don't need the lower right now. I'm just going to work on the upper. Depending on what you click, the system will give you the default, what to work on. So I'm just going to bring these back. So if I click on the lower, right, I can get rid of that, and I can get rid of that. Now I'm working on the lower. Or if I bring everything back to life, so to speak, click on the upper, and now it's telling me to get rid of that and that. Depending on your style, how you want to sculpt your dentures, you can do it with the models or without. I like to start without, and I'll start, really doesn't matter where you start. Just make sure you got a nice angle for it. Now, if we look over here on the left side, I'm going to pick the sculpting tool, and I like this distance here. I like the 4.1 or maybe 3.2, somewhere in there, and no more than 30 microns. Let's start with that. If you like this setting here, when you're applying or you're sculpting the image, you can hit this little save button and default it to a number that you like to default to. Yes, I'll go to that one. So no matter what happens here, if I hit number 7, that's my favorite, I'm going to go to that. So if I'm happy with that, I'm going to hit the plus sign, come over to the area that I want to sculpt, left click and hold, and now we're adding material, which is quite a bit. That's too much material added at one time. So I'm going to undo. That's gone. So I'm going to go back to my settings and change this down to 10. And I'm going to change this to 4.1. And I'm going to save that as my favorite because I've done this before. And this, for me, at least in my eyes, is the ideal build up and radius for the sculpting. So here I go. I'm going to hold my left button and I'm going to start adding material to make it look like what we've been working on for months now. So it's a very smooth transition to the edge of our border. You can change the angle around and you can see the difference now between that little section right here and that section here. There's a lip here. The lip now is eliminated. Granted, there's a bit of a ledge here, but this is something that could be easily trimmed off after the denture is either printed or milled and of course polished. There we go. In addition to adding, we also have a removal. If we went too far, you can always remove material or go back and add it. Finally, when you're happy with your sculpting and the rendering, what you want to do is hit this smoothing icon and go back, and this just gives it a final, almost like a glazed layer on top of it. Oops, I have to select, yeah. It just gives it almost like a very fine layer where it smooths everything out. I tend to go over everything in the end. So I'm just going to do half of the arch. I'm just going to do quadrant number 1. So I'll go back on my adding tool. I'll just do the first quadrant just to show you the difference between before and after. So you have to find the right intensity that works for you. In the beginning, until you get it right, caution of having too much material and not enough. Because if you have too much, you can always trim it away. If you don't have enough, well, we all know what happens there. It takes a lot of time and effort to add, and we're going to add it with cold cure acrylic that really it becomes more of a patch job than anything else. So I'm holding down my left mouse and I'm gently moving my mouse around. Notice I'm not stagnant with my mouse. I'm moving it around, trying to build up until things start to look ideal for me. A little more here. And if it's a little bit too much, that's all right. I can trim it away with a burr and polish it. Just make sure you have enough. Let's go back and touch some of the other areas. So think about the time and effort that it takes us to do a conventional fabrication between the setups and the sculpting, the wax up. Hours, right? 5, 6, 7, 8, 10 hours sometimes. And it took me literally half an hour. And I'm sure in good time, it will probably take you less than that. And even if it didn't take you less than half an hour, it's still an amazing leap forward in terms of accuracy, production, efficiency, and actually quality of product. Not to say that a good pair of hands cannot produce something that the software can. I'm a big proponent of still using conventional methods if they're done properly. But you have to put it in your hands and you have to see what works best for you. And this is just given the opportunity to work with the system before you graduate and decide what's going to be working best in your clinics, working with your clients to make sure you provide optimal treatment. So I think I'm happy with that. Not much to do on the lingual side. The software produces a very smooth lingual side that I'm not going to mess around too much. Possibly maybe select the smooth section here and just maybe smooth things out, but I don't see too much of a difference, so I would just leave it alone. All right, go back to my frontal view. Bring up my lower, so you can see here the difference between quadrant number 1, how everything is sculpted to an ideal size and shape and contour, and quadrant number 2, 3, and 4. Nothing has been done here. Even though we didn't do anything on the upper lingual side, I'm going to click on the lower. I'll do it very quickly. I'm going to get rid of the upper and go back to my sculpting tool, add, and I'm going to start. I won't do this completely because obviously the video is going to get extremely long. So you can see material is building up quite nicely. I think the trick is here is to find the right intensity of the buildup by selecting, having the proper settings here that you see fit, and also keeping your mouse moving all the time. Don't stay still. Keep it moving. And you can see the change in shades. Maybe change the angle if you like, but again, having the right angle, you look at the concavity that we have here, it's quite a bit under the canine, so I'm going to build this up a little bit just to get rid of it, smooth it out. And that's not as intense as before. It's a little softer. There we go. So I think going through the conventional process makes you appreciate and develop the skills required to work on the mouse. And I think it's a good transition between starting off in conventional and working into digital throughout your learning process. So even though we didn't do anything on the upper, on the lower, I need to build this up to get rid of that steep concavity in there. The lingual depression that we have here to allow room for the tongue, maybe just build this up, change the angle to make sure you're at the right angle. That looks great. Little concavity in there. Build this up a little bit, and then rotate inside the retromalahyoid area. Build that up, so make sure it does not become too thin or too edgy. So we're going to contour it to be a little smoother here. Maybe on top of the retromolar pad, add some material so it's not too thin. We can always trim this back, remember. We can always trim this back and polish it. So again, by rotating the image a certain way, gives you certain lighting exposure that might help you decide how much you need to add, how much you need to take away. There we go, right there. Everything is nice and smooth. A little bit there. Drag this down, rotate a little bit. That looks pretty good. I'm going to leave it at that. Let's go back to our frontal view. So you can see here, I'll bring this back on here. So between quadrant 1 and 4, there's the new contour, and this is the before, and this is the after. And if we look at from the inside, I'm just going to get rid of that and that. You can see the before and after between this side, right, and this side here. So between quadrant 3 and quadrant 4. So obviously once you've gone through the full contour of upper and lower, and you're happy, this is probably going to take you the most time out of anything. You can literally spend half an hour on this, or you can spend hours on it. I'm going to hit next. And this takes a little bit of time for the software to mesh together, because there's a lot of input that we accumulated by clicking and clicking and clicking. And once that is done, we get a prompt on the top left of the screen that we can send. If we hit send, if we want to send out to be milled or printed. We're not going to do that, but automatically saves it as well. Okay, so there's our new file. Just going to X this out, and I'm going to exit this, and I'm going to exit the system altogether, just to show you how we can reload the file and work on it and make necessary changes. So I've shut everything off. I'm going to go back on the software, agree to the licensing terms. So once we create a file, we can always go back and modify the file if we have to, or we can reprint the file. Let's say in the event the patient loses their dentures. Well, we don't have to call them back for impressions. We have the file. We can just print a new set of dentures or mill a new set of dentures for them. So I'm just going to hit later, and here's our file. Okay. There's the contact person, me. This is the one I just saved. So I'm going to right click and redesign. Accept. So once we generate a file, it's there until we delete it. There's our file. We already done this, remember? Points of interest. We did our spline. So if I want to go back and modify or continue working on my sculpting because I've run out of time, I had to go somewhere, I can go back and open up a file and just go through the steps. Just be patient for the software to catch up. You can modify your path of insertion if you wanted to. Going to hit next until we get to our tooth library. Here it is. We should be able to see our setup now. There it is. And if I hit next, this is the teeth that we selected previously. And if I hit next again, yes, we're going to default to that. It's saying that the minimal base thickness is violated, which is fine. And yes to that. And again, this takes the longest for the software to generate and mesh together. That's all those inputs of the sculpting. So it's going to go back to where we left it, and we can go back and add some more or take away some until we feel it's adequate. Just going to hit next and yes. So let's do the same thing for the lower. So we should have the image that we had before were the quadrants 1 and 4 were completed, and quadrants 2 and 3 were not. So it's uploading everything again from the file that we had saved. You can certainly save the file into an external memory stick and upload the file that way, or you can save it in the desktop itself. Just be patient when you see something like that. There it is. So let me bring up both models here. There they are. And I'm just going to remove this one. You can see, remember this one that we sculpted, and this side we didn't. And same thing for the lower. All right, so you can bring back the file and work on the file if you run out of time. So it's not time restrained or anything like that. And from here on, like I mentioned earlier, you can send it to a printer, you can send it to a milling unit and have the bases milled. And I'm hoping that in years 2 or 3 of your learning experience at George Brown, you'll be able to do that and hopefully put it to use for some of your clients. I hope you enjoyed the video. It's as lengthy as it is. It's probably going to take you a little bit longer to get to know the system in the beginning, but like everything else in life, practice makes perfect. All right, take care.